It started with a series of unanswered questions. Reedy Tarial wanted to know more about her reproductive health, but she seemed healthy, and doctors were not willing or able to give her any answers.
There are no tests that exist that are able to give you that type of insight, or they are hard to access, or insurance doesn't cover them.
And she was not alone. According to a study published in the National Library of Medicine, women in America report that it can take up to 11 years to get a diagnosis for endometriosis.
And there's so many diseases like that present with generic symptoms. It could be infertility, actually. There's so many questions like that women experience.
So Reedy chose to focus her research into the female reproductive system by looking at one of its most basic processes.
We started to develop this concept that maybe by looking at menstruation, you could find easier, more intuitive ways to build tools to understand what's happening in your body.
She created NextGen Jane, a tool designed to give women insight into their own bodies. Each month, participants are sent a kit that includes a tampon and a container with a preservation buffer that can be sent via regular mail to NextGen Jane's Oakland lab. From there, they analyze a specimen looking for disease biomarkers.
You want to be able to pick up conditions that people might have way before it manifests into some type of very visible clinical manifestation, right? You want to try to pick up endometriosis before someone has debilitating chronic pelvic pain. You want to try to pick up infertility before they're at the point where they've been trying for 5 years unsuccessfully.
Reedy says that research like this is crucial for the advancement of women's health.
You're not going to answer these questions unless you fill that data gap. You're not going to fill that data gap unless you are actually developing really well-calibrated clinical studies across these diverse populations.